Hi, welcome to your week 6 post-op video. So this week I really want to focus on acid reflux, and specifically for those of you that have had the gastric sleeve. This is unfortunately one of the negative side effects that can happen after the gastric sleeve. Medical professionals aren't exactly sure of the exact reason and cause, but believe that it has to do with the different pressure changes that happen to your stomach after the sleeve procedure has been done and that the excess stomach has been removed. So talk to your physician about maybe what the best treatment options for you if you continue to have acid reflux, months after surgery. For most people, it tends to get better the further they get out from their procedure, but for some it does continue. So again, talking to your physician and having that good relationship with them can really help you with the best treatment options long term. But there are some really good tips and suggestions that we can give for just general lifestyle modifications to help with those symptoms of acid reflux. The first is to really monitor your symptoms and evaluate sort of your trigger foods. So this is where keeping a food log can be really beneficial, so that when you experience symptoms, you can write down maybe what those foods were that you had more recently that could have kind of aggravated those symptoms of acid reflux. Some common foods for people are alcohol, a lot of acidic foods or citrusy foods, fried foods, tomato-based products like marinara sauce or salsa, taco sauce, those sorts of things, and chocolate, as well as mint or peppermint tea. So maybe you're having a cup of mint tea 30 minutes after your meal to sort of help settle your stomach, but that could actually worsen your symptoms. Garlic and onions can also be some other offending foods. So it's really important to also eat very small, frequent meals if you're noticing more acid reflux. So maybe waiting those 3 hours between meals, kind of breaking up those meals a little bit more. Also taking a pause while you're eating. So I think it's really important to have maybe 5 or 6 kind of small bites of food. Again, not wanting to have more than 1 to 2 bites of food per minute. And then after you'd go, 2 to 2.5 minutes or so, having a pause of 1 minute or 2 minutes where you don't eat anything. You just wait and kind of allow that food to, continue to move down your esophagus, to sort of settle into your sleeve or your pouch, and just sort of notice how it feels. And then, you can begin to eat another few bites. After surgery, especially when you're this early, those first 3 months out, it's difficult to really know what your fullness feels like now or how much food you can have, especially as you're transitioning to those more solid foods. Your place changes with what your fullness looks like. And so taking that pause can really allow you to sort of notice those sensations and feelings. A lot of times after surgery, that fullness will just feel like a very slight tightening in your stomach, and then anything that's continuing to kind of travel down the esophagus can really put that pressure over the top and make that acid reflux worse. So I know that's a winded explanation, but I really hope that helps. It can really also benefit you to maybe get a wedge pillow or to get several pillows at night to sort of prop your head up at the end of the bed. It's also important to not lay down for 2 to 3 hours after you get done eating a meal, and really avoiding alcohol and especially nicotine. Nicotine can really make your acid reflux worse. So next, I'd really like to focus on your fitness. Week 6 is typically when most surgeons will give you the clearance to go ahead and kind of resume normal activities. It's a good idea to reach out to your surgeon or your primary care physician to make sure that you are in a good spot, that you can begin to do exercise again. The general recommendations are 150 minutes per week of moderate activity, intensity activity, or 75 minutes of vigorous. So typically, you know, the moderate is kind of more where we are at this point after surgery and going through that healing process. So it really kind of breaks down to about 30 minutes a day for 5 days out of the week. So you can have a couple days there off where you're not maybe doing quite as much, but it's really important to try to do something physical every single day. You know, even if you can't get that 30 minutes, 5 minutes still counts. There's so much benefit that still happens. And especially for those of us that have had surgery, you know, as you lose weight, your metabolism actually slows down, which I know can seem strange when you're maybe losing all of these pounds. You think, well, my metabolism is higher, but it's actually lower. And so when you can be more active, when you can gain that muscle mass, you actually increase your metabolism. And this is something that becomes really important as you get a few more months out from surgery and start to hit more of those weight loss stalls or plateaus. It's important to continue to really build muscles to keep that metabolism going and to keep those muscles kind of guessing. That keeps that metabolism high. So doing your aerobic activities is really important for your heart, but also a lot of that strength training, you know, lifting weights, maybe doing Pilates, yoga. These are really important activities. And for females especially, we tend not to want to focus on the resistance activities as well, but that's extremely important for us, especially to kind of combat that adipose tissue that sort of kind of settles in the middle of our bellies or makes us have that apple shape as opposed to maybe that pear shape that you were when you were younger. So again, really focus on all activity, but especially those resistance exercises. So there you have it, some tips and suggestions for week 6 post-op. Thanks. So please let us know in the comment section below how you deal with acid reflux, if there's any lifestyle tips or changes that you have particularly found helpful for helping to treat your acid reflux or just to keep symptoms at bay as much as possible. And as always, please remember to like and share this video. Thanks.